with us at this time. We're going to go to other board matters, beginning with the referral matrix, and see if we have any new referrals to report this week. We're going to go to referral responses. Item 23 today is to consider a preliminary analysis report in response to board referral number 2024.16, seeking to establish on-site mental health services for children and families served at the Share Center. So we'll go ahead and send that to Elsa Jimenez, who I believe is joining us via Zoom for a brief presentation.
So good afternoon, Chair, members of the board, members of the public. Elsa Jimenez with the Health Department, here to jointly present with Director Rodericks. I presume he's in the audience. And I also have a few of my colleagues from behavioral health with me on Zoom this afternoon. So today we are here to present a preliminary response to board referral number 2024.16, which is seeking two things. The first, to assess whether or not we need to establish on-site mental health services for children and family that are being served at the Share Center. And secondly, which I will defer to my colleague, Director Franks, regarding any modifications to the Memorandum of Understanding between the county and the City of Salinas, and the coordination and communication and advance notice of those proposed changes. So I will speak to what we as a health department have been doing with respect to the first part of provision of mental health services on site. As you are aware, the Community Human Services is the recipient of the RFP for serving as the service provider at the Share Center. They are also one of our behavioral health providers that is contracted with us to provide specialty mental health services in the community. Our health department staff, specifically our Assistant Director of Behavioral Health, working out of class, Fabricio Chombo, has been in communication with leadership at CHS to really better understand what they are seeing with respect to clients that are assessed at the time of entry into the Share Center, and what actions they're taking if they do identify that the individuals could use additional supports in the area of mental health and or substance use disorder services. So all individuals at the time of intake are assessed, and if this need is identified, what CHS is doing now is they are referring them to off-site contracted providers. It could be themselves, it could be any of our other behavioral health contracted providers, to be able to receive those services. If transportation is a challenge or a barrier, that transportation is provided by CHS. They are actually in the process of going back and further reviewing to determine the extent of how many individuals have needed that service, how many have been linked and referred, how many have kept those appointments, where on the spectrum are they? Are they more in the mild to moderate or more in the severe? And so once they gather that additional data, they are going to be circling back with us, specifically our behavioral health team, to determine what are most appropriate next steps. In addition to referring individuals who are on the moderate to severe spectrum to any of our behavioral health contracted providers, we also have Central California Alliance for Health mental health providers that can be referred to, the clients can be referred to their primary care clinic sites or any of those independent contracted providers for those individuals that are on the lower end of the spectrum. As I mentioned, right now, according to CHS, individuals are being referred and connected, and more data is being gathered so that we can have a more thoughtful discussion about whether or not there is a need for us to work with CHS and with Central California Alliance for Health and perhaps others to determine what the best solution would be if we needed to provide on-site mental health services. I will also add that telehealth could be an option that could be explored, as well as perhaps revisiting our contract with them if we needed to provide those services on site, and also maybe establishing more of a connection between CHS and Central California Alliance for Health for those individuals on the lower end of the spectrum. At this point, you know, from the health side, we do think that we could come back to the board sometime in March with an update to what we have learned from the assessment that's being conducted by CHS.
Lopez and Supervisors, Roderick Franks, Director of Social Services. Yes, in looking at the component of the referral requesting that the board be notified prior to any expected change with the provider of the share center or any significant concerns? And would the current MOU with the City of Salinas need to be modified to accommodate that? After really taking a close look with the assistance of County Counsel at the current MOU, we believe that we can accomplish the goals of informing the board in a timely manner if there were any indications of a need for a change of provider, if the provider indicated that they were interested in terminating the current agreements that they have as operators of the share center with the city and with the county, and if there were any other significant concerns that were found to be at the share center that would require the board's attention. We could certainly do that by first initiating through the committee process, getting the guidance from the health, human, I can't remember how many H's are in the committee now. I think there were 3 and now there's 4.
4H, yeah.
We're back to 4. Getting the guidance of the committee and then coming to the full board for their consideration as well. In regards to reporting on certain data that the referral indicates that the board would be interested in knowing, the current agreement that we have with the operator of the share center indicates that they are required to give an annual report to the county board to be held at a public meeting of the board's choice. And there are a certain number of minimum data points that are required to be presented in that report. I can go through those just generally. They're a summary of all the clients, the percentage of unsheltered individuals who have been placed at the share center and subsequently entered permanent housing, the number and percentage of individuals connected to or maintaining enrollment in any benefit type, referral origin for persons at the share center, and a number of other data points as well. That's a minimum. So we are certainly more than willing to comply with the agreement and assist the operator of the share center to ensure that they contact the board to secure a public meeting to discuss their annual report. We believe that both of these items can be accomplished without amending the current MOU. And partly that was decided because opening up the MOU for amendment would require probably extensive conversations with the City of Salinas and ultimately an agreement on a new MOU that the city would also be agreeable to. Thank you.
All right, Supervisor Alejo.
So since this is my referral and since Roderick is there, if there's another way to do it, like a side letter to the MOU, I'm open to that.
Okay.
All I want to do is avoid when you're gone, when maybe some of us are gone, that we don't have a repeat of what happened this last year, right? I hope homeless community, the provider, what is it? Human Services.
Community Human Services.
Community Human Services, because there's another agency with a similar name. I hope they stay a long time, right? Because I think that not having continuity and getting staff trained and building the trust is important. But if there is a change, I did read the agreement, and the agreement was crafted when we had no share center. So it's all focused on hiring a provider, not having a successor provider take over. And issues came up to attention of staff. Staff made decisions. By the time it went to the council, it was far in the process where the current provider already made a decision to leave and not want the contract. By the time it came to the board, it was many months later, from April through August. It came to the board's attention, to my attention, and we were just ratifying everything that already happened. I want to avoid that. I want to avoid early on when issues come up, and if there's a provider that's thinking about leaving, that it comes to the attention of the city council and the board as the governing bodies. That seems like a simple request. And if it's not in the MOU, a side letter just saying that in the future, the council, the Board of Supervisors will be notified and involved earlier on, rather than staff having discussions that we're not aware of, and we only come at the very end when it's too late to perhaps save a relationship that we had, to address the issues that they were bringing up. On the reporting side, what I thought that was important, not only to know, for the board to know when they ask, how many people did we serve at the share center? How many kids and families stayed there? we should know clearly every year. That's an easy number. Number two was the other component that I think was more difficult, which was the rapid rehousing. Those that are staying at the Share Center, how many did we get into permanent housing? There should be some transparency there, and Box had really good numbers, 75, 80, 85%. I just want to make sure that those numbers come back to us so that it remains a top priority. And I'll give you this. I've been in touch with some of the clients there. There's a client who's been there like 8-10 months. He's working. I said, have you been offered rapid rehousing? He's like, no, I've been here this whole time. So there's some able working residents staying there for many months that just haven't been transitioned. And so I want to raise those too, because everybody that we can get into housing, the money is there, the rapid rehousing funding is there, the staff is there. I want to make sure that people that could move on and get into permanent housing do that. There is possible time, which would also free up space for others wanting to stay at the Share Center. So those and these are real examples that come to me that I want to make sure that we're addressing better in the future. The first point, which Elsa addressed, I want my board and Supervisor Giles to know that that wasn't my recommendation. It was from Jamie Almanza, who is the Executive Director of the Bay Area Community Services. When all this came to my attention, I had a one-on-one with her. She let me know all the issues that went on that where it couldn't save the relationship. But one of her recommendations, she made several, but one goes, we should have the mental health, behavioral health services at the shelter. Why we don't have it? If there's one thing, Luis, make sure we get that on. And it doesn't have to be on site. If Elsa thinks it's better to make sure as part of their intake process and their caseworker staffing is to connect them with those resources, so be it. But I just want it to be part of the program where we're connecting every child or every adult that needs it, that's eligible, with those mental health and behavioral health services. So I'm open to that. I just want to make sure that we're addressing those perspectives that were there from our previous provider. So that's why I just wanted to know where that came from. And I just want to make sure that it's accomplished in some way.
Supervisor Daniels, any thoughts? Supervisor Askew, any thoughts? All right, let's go out to the public on this one. 1 second, I open public comment. I see nobody here, no hands via Zoom. We'll close public comment, we'll bring it back. Back to you, Rod.
Thank you, Chair. To respond to Supervisor Leo's comments, just briefly, yes, the transition to permanent housing from the shelter is one of the required data points, so we'll make sure that that number is there. We can certainly look at other metrics to see how effective the rapid rehousing efforts are actually being, because these data points that are in the agreement are indicated to be a minimum, not all that we could ask the operator to report on. In fact, I have our community affiliations manager, John Gill, as he's walking up, I think he just received some new data on some of the rehousing efforts that have been done. This might be a good time to share that.
All right.
Yeah, and then I was thinking too, if we are coming back in March, we could certainly look at creating a side agreement with the operator indicating maybe certain timelines about how much notice they would need to give to the board. So we would have the time to actually go through our process to give you proper notice through the committee process and then to the board. So we will certainly take a look at that as well. The city and the county each have separate agreements with the provider and the operator. So I think that is something that we can certainly take a look at doing as well. John?
Yes, thank you, sir. Good afternoon, Chair and Supervisors. We with the provider as well as the city, we have ongoing meetings with operations, finance, and so forth. And the last meeting, they shared that there was 19 exits from the Share Center, and I think a large percentage, I don't know the exact number, 15 or so, were positive exits. A few went to families and others just didn't come back. But there is an effort being made. There's also been a reevaluation of their case managers and which ones are truly effective with certain type of people and which ones aren't, and making a shift when needed. There's also an observation of which case managers are a little bit more aggressive with the recipient, and it is being effective. So then, besides managing caseloads, to not overload one case manager more than the other, All these different things are being looked at, and definitely like Director Franks mentioned, with the city, we do have a partnership, and we're equal in providing the funding, looking at the operations, and monitoring the performance. So like I said, it's an ongoing effort that's being done between the city and the county, and working with the Community Homeland Services.
Mr. Gill, I would only say though, it's hard to measure just that number. We looked at the first 2 years of box of the rapid rehousing. First year, 75% of eligible persons were put in permanent housing. Second year was like 85%. It was pretty remarkable, and that's where when we evaluate, we want to make sure that our board expresses to our provider, we need to have similar achievements, right? It is possible. If one provider could do it, the staff need the right training, they need to hire the right kind of staff. And even Vox, when they left, they said, we asked, is there any other, would you be willing to do other services? Said we probably could continue the rapid rehousing. So if one agency is not doing right, could we contract with another agency that is good at it to continue that piece? And that's what I'm saying. Let's not settle for less, or they're barely learning, or they're not the right set. We have to ask that we could achieve the same goals as a previous provider, not less, because then we know we're not fully carrying out the work that is possible as proven by the previous provider. That's all I'm saying, and that's why I want to be able to track that yearly to say how are they doing, and if they don't have the right staff to do it, who else is out there that may be able to do it better. That's all I want to keep that challenge out there, because our community wants us to show that we are making significant progress in getting folks at the Share Center into that permanent housing.
Very much appreciate your comments, Supervisor. We are spending a lot of time with this operator as a new operator, trying to nurture their progress and really assist them in any way that we can. As far as our agreement with the operator, their performance objectives are exactly the same as we had in the agreement with Bax. So we do not see any way that we should lower our standards at all because we are working with a new operator.
All right. Seeing no other questions or comments from the dais, well, thank you for the presentation. I look forward to the next report. Much appreciated.